Okay. Um, Welcome everybody we have a very special speaker today. Um, Trevor Hancock, as you know, or as you've seen in the description that was sent out, is a highly accomplished physician, public health physician. Um, he he actually, I work with him on a program, like we're trying to develop an institute for planetary health. But the more important thing is he's also one of the founders of the Green Party. He co-founded the Canadian Association for Physicians for the Environment, which is still very active and successful in lobbying for a lot of different changes. And his recent focus has been on the combination of the really addressing the interactions between the environment and climate change. And I think at this point, I will hand it over to Trevor. Trevor, you're on.
Thank you, and good morning, at least where I am, which is on the traditional and unceded territories of the Lekwungen-speaking people, which we call Victoria in British Columbia. But for some of you, I know in Ottawa and other points east, it's good afternoon. Thank you for the invitation. I much appreciate it. I am going to talk about this, and I'm going to move fairly quickly through the first set of slides because it's stuff that we should all be familiar with. But I want to talk about these two big challenges in particular of declining planetary health and increasing inequality and what that response should be. So I'm going to talk about these 6 big themes: surpassing limits, deepening inequality, the impacts of all of that on health and health equity, and then the response in terms of the well-being society, transformative change, and some suggested steps that would take us towards a well-being society. So let me start with surpassing limits. You know all this. This is old stuff, very old stuff, as I point out here. I date my own engagement in this work back to that first UN Conference on the Environment in 1972, and in particular, for me, Blueprint for Survival, published by The Ecologist, which, among other things, called for the creation of ecological political parties, which is what led me into green politics in the 1980s or 70s and 80s. So today we talk about planetary boundaries and ecological footprint and safe and just Earth system boundaries, but it's really the same conversation 50 or more years later. You will, of course, be familiar with this, I'm sure. This is published a year ago now, at which point the folks behind the planetary boundaries work estimated we had crossed 6 out of 9 planetary boundaries and were approaching 2 others, in particular ocean acidification. Just a couple of days ago, they published a new report, which The Guardian picked up, saying that it now may be 7 of 9 planetary boundaries. And this, which comes from the executive summary of that planetary health check in 2024, the top is the sort of overall status. But if you look 3 down from the top, you will see under ocean acidification, it's approaching the planetary boundary. And the other thing about all of the things you see here, with the single exception of atmospheric aerosol loading and perhaps ozone depletion, is that the trends are all in the wrong direction. They're all expected to get worse and are moving in the wrong direction. So we know we're in deep doo-doo, to use a scientific term. This is the ecological footprint over time. And back in 1972, at the time of the UN Conference on the Environment, we were just about at 1 planet for the global ecological footprint. Canada was already at almost 4 planets. Since then, it's gone up to 1.7 globally, and we're almost at 5 planets in Canada. What people don't really get in this is that to get to be a 1 planet society, we would have to reduce our ecological footprint by 80%. This is more recent work, and there's just been an update to this too, which I don't have in here yet, that added a justice component into the work on planetary boundaries. And the key point here is that we have crossed a safe and just boundary in 7 of the 8 areas that were considered here. So climate at the top, we haven't yet passed the safe boundary, so-called, of 1.5 degrees, but we have passed a just boundary, which they estimate to be 1 degree. So in a variety of ways, planetary health is declining. And it's declining in the context of a polycrisis. This is from the Cascade Institute a couple of years ago, and I'm not going to go through all of this, but this is what they call the components of the polycrisis. So we're in the midst of a polycrisis of which planetary health and inequality are 2 big concerns. And then this from Antonio Guterres just a few days ago, ahead of the UN conference on the future, UN summit on the future, that things seem to be spinning out of control. And he talks about out of control geopolitical divisions, runaway climate change, runaway inequalities and debt, runaway development of new technologies, and the challenge of just keeping up with all of that. So that is the context within which I want to talk about the Wellbeing Society. The other big component of this, because a lot of that focus, of course, is on planetary health, but we also face deepening inequality. This is from the most recent World Inequality Report. There should be another one out this year, but this is the most recent one. Addressing the challenges of the 21st century is not feasible without a significant redistribution of income and wealth. And in particular, the important point they make that inequality is a political choice, not an inevitability. We might want to talk about that, but I think that's a good place to begin that discussion. And this is from that report a couple of years ago. This was the situation in 2021, where income on the left, wealth on the right, and you can see the bottom 50% get 8.5% of income and only 2% of wealth, while the top 10% get 52% of income and 76% of wealth. And this is a massive inequality, quite clearly, and the 1% aren't even in here. But not only are the rich getting richer, the poor are getting poorer. And so this is again from the World Inequality Report. The top 1% captured 38% of global increment in wealth in those 15 years between 1995 or 25 years between 1995 and 2021. And the bottom 50% captured only 2% of the global increment in wealth. So the gap is widening. And this is true also in Canada. You'll notice in that second bullet, income inequality in Canada has been rising significantly over the past 40 years. It's heading back towards where it was in 1900. So we sit somewhere between the US and Europe, as we do on so many other things. But we have significant inequality in Canada. And this is important for 2 reasons. One is, as the UN report, Our Common Agenda, put it, poverty, discrimination, and violence and exclusion are denying them their rights to the basic necessities of life. And so this becomes very much a health issue. And back in 2008, the WHO had a commission on the social determinants of health, and their key finding is bluntly stated right there: social injustice is killing people on a grand scale. So you combine the two, the combination of social injustice and declining planetary health, and you have a major problem, never mind all the other elements of the polycrisis. When you do combine those, what you get is what some people refer to as ecological or environmental injustice. And so, for example, when it comes to the ecological footprint, the top line there is the ecological footprint of high-income countries. The bottom line is the footprint of low-income countries, and the middle line, of course, is for middle-income countries. Middle-income countries actually have an ecological footprint that just about matches the average world biocapacity per person. So there's massive inequality in the ecological footprint. There's also massive inequality in the Living Planet Index. I don't have more recent data. The Living Planet report doesn't seem to have repeated this particular analysis since 2014, and that was for data up to 2010. But again, the key point is that while high-income countries have actually seen an increase in their Living Planet Index in that period from 1970 to 2010, middle-income countries and even more so low-income countries saw a decline. So we have massive ecological inequality reflected here. And that is also reflected in climate change. This comes from the World Poverty Report 2022. And you'll see that the bottom 50% of the world's population produce 12% of emissions, carbon emissions, greenhouse gas emissions. The top 10% produced 48%, and in fact, the top 1% produced 17%. So we have inequality everywhere, and that in turn has impacts on health and health equity. So the UN has been referring for some time to what they call a triple crisis, the three big planetary health disruptions of climate change, biodiversity loss, and pollution, which Antonio Guterres highlighted in his Common Agenda report in 2021, 3 years ago now. So if we look at some of that, what we see is, first of all, that climate change has been described by many, WHO since at least 2008 has described climate change as the greatest threat to the health of humanity in the 21st century. And this was an editorial published in 230 leading medical journals around the world about the need to keep global temperature rise below 1.5 and to restore nature. So combining the biodiversity loss and the climate change challenges. And WHO, in its special report on climate change and health at COP26, highlighted that the people whose health is being harmed first and worst by the climate crisis are the people who contribute least to its cause, that bottom 50% that we saw in the earlier slide, and who are least able to protect themselves. And that's people in low income and disadvantaged countries and communities. And that is true in Canada as it is around the world. So climate change not only has massive impacts on health, those impacts are inequitably having an effect. Similarly with pollution, diseases caused by pollution responsible for an estimated 9 million premature deaths in 2015. That, I would add, is an underestimate for a variety of reasons, but probably quite a considerable underestimate. And yet, even as an underestimate, it's 3 times more than the combination of deaths from AIDS, TB, and malaria, and 15 times more than from all wars and other forms of violence. And yet, it doesn't receive anywhere near the attention that it is due. And also, and again, it disproportionately kills the poor and the vulnerable. Nearly 92% of pollution-related deaths are occurring in low-income and middle-income countries. This is work from the Lancet Commission on Pollution and Health, by the way, 2015 or 2017, I think, and then updated in 2022. In countries at every income level, disease caused by pollution is most prevalent among minorities and the marginalized. And again, that is true in Canada, as is the higher risk to children. So pollution is the second of the 3 triple challenge components. And then biodiversity loss, which poses risks to food production and to nature's ability to support human health through regulation of air and water quality, and so on. This from the UNEP report, Making Peace with Nature. And Indigenous people in particular will be affected by this, and that is also again true in Canada, where Indigenous communities, and particularly communities in the north, are threatened by the ecological changes that we're seeing, far more so than elsewhere. So in a variety of different ways, the declining planetary health not only has massive health impacts, it has very inequitable health impacts. And that becomes a particular concern. So that is all by way of just preamble. That is to say, we should know this stuff. It's nothing new about it. It dates back at least 50 years for the basics, and all the detail that's been filled in since then has really just fleshed that out. So what do we do about all of that? Well, working as I do in the field of public health and planetary health and health promotion, and having worked for, among others, WHO and national and provincial governments and all sorts of folks, the thing that I have found most promising is this recent emphasis by WHO on what they are calling a well-being society, which includes a well-being economy. So this is from a document called the Geneva Charter for Wellbeing, which was the product of the 10th Global Health Promotion Conference in 2022. And a well-being society, it defines as societies that are committed to achieving equitable health now. So health that is fairly distributed. Equitable is not the same as equal, by the way, and we can talk about that too if you like later on, if that's not clear. But equitable health is not equal health. But equitable health now and for future generations. So importantly, bringing that in, which of course is particularly relevant given that they've just produced a declaration on future generations at the UN yesterday. But all of this without breaching ecological limits, which means staying within a one planet footprint globally, and therefore, to be fair, nationally as well. So that is what a well-being society is committed to, and the question is, how do you actually achieve that? So in that document, the Geneva Charter for Wellbeing, they outlined 5 areas for health promotion response, and I want to focus on the first 3. I'm leaving aside for now the achievement of universal health coverage and the impacts of the digital transformation. But I want to talk about valuing, respecting, and nurturing planet Earth and its ecosystems as the first area of response, designing an equitable economy, or as some would call it, an economy fit for the 21st century, as the second area of response, and developing healthy public policy, which incidentally is a term that I created and held the first international conference on back in 1984 in Toronto, healthy public policy for the common good. So those are 3 key health promotion, or more broadly, societal responses I want to talk about in the remaining time. So if we start with this one, valuing, respecting, and nurturing planet Earth, this is I found a very powerful statement from Antonio Guterres 4 years ago now. Making peace with nature is the defining task of the 21st century. And you will know that there was a UN Environment Programme report called Making Peace with Nature that came out about then. And Guterres said it must be the top priority for everyone everywhere. I think that the fact that we've crossed 6 and probably 7 out of 9 planetary boundaries makes it very clear why making peace with nature has to be the top priority for everyone everywhere. I've always found this very helpful, and in fact, I wove a whole homily that I gave at the Unitarian Church here in Victoria a few years ago, earlier this year. I wove a whole set of statements around values around this. I took this as my scriptural text for the homily. Ecosystems sustain societies that create economies. It does not work the other way round, said the World Wide Fund for Nature in their 2014 Living Planet report. And so this is how they then illustrated that. So the ecological domain, which encompasses the social domain, which in turn encompasses the economic domain. That's the way it is, or at least the way it should be. Unfortunately, we seem to think it works this way. And so we've put the economy at the center of much of our thinking and much of our values, and nature even excluded. The whole notion of externalities or nature and or social and ecological costs as externalities in economic decision making tells you that they are literally excluded from consideration and subservient to the economic domain. So that's how we seem to try and make it work. And of course, it doesn't work. So making peace with nature becomes the first priority that we need to address. The second, because of the importance of the economy in this model of the way, not the way we operate the world so often, we need to design an economy fit for the 21st century. Now, I'm not going to go in depth into all of this. When you get the set of slides for this, if you choose to get them later, you'll find there's a whole bunch of slides that I've hidden just for the interests of time that deal with different aspects of the economy and the problems with that. And I'm assuming also that for many of you, these are not new ideas. But the first problem we have is that we have an incomplete understanding of wealth. So we think that wealth is the economic domain, and that's pretty much it. So there's very little attention paid to social capital or to ecological capital or to human capital, which isn't shown in this particular model, but it is shown in other models. Human capital is not quite the same as social capital, in as much as human capital is basically invested in the individual, whereas social capital is about our relationships with each other, formal, informal, or a category I call the invisible social capital that underpins our society. So when we think of wealth, we talk about the GDP, so we measure the wrong things. The only thing you can really say about GDP is that it is gross, but it doesn't measure what we need measured. And in fact, Simon Kuznets, who was one of the key architects of the GDP, cautioned the US Congress way back in the 1930s that GDP should not be seen as a measure of social well-being. But in fact, we do measure social well-being, or we try to measure social well-being through the GDP. So we measure the wrong things, and we don't therefore measure the right things. So we don't measure the planet's well-being, we don't measure human well-being, we don't measure social well-being. And obviously there's a lot of work going on to remedy that, including at the UN and around the world in lots of places. And so we have notions such as the Canadian Index of Wellbeing or the Genuine Progress Indicator or other ways of measuring wealth, measuring progress, which is the third point here. We have a mistaken conception of progress. We think that progress means getting more of stuff. So too often growth in GDP is assumed to be progress. And when in fact, the things that make up GDP can be very harmful. I always use, as a public health physician, the example of smoking. All of the economic activity of smoking adds to GDP. And all of the economic activity of treating people with tobacco-related diseases also adds to GDP. So it's a crazy way of measuring anything. And finally, we don't understand exponential growth. We don't understand that 3.5% annual growth means a doubling time of 20 years, which means that in an 80-year lifespan, a child born this year who probably, well, we say they have a life expectancy of around 80 years. Of course, we don't know that because those 80 years haven't happened. But if you take that for the moment as an estimate of how long children born this year will last, 3.5% growth per year over their 80-year lifespan would mean the economy would increase 16-fold. And our current economy is doing more than enough damage, never mind increasing it 16-fold. So as a result, I would say our economy is waging war on nature and thus on us. So there's a lot more slides that deal with that, but I'm going to skip over those. I just do want to go back, though, to Kenneth Boulding more than 50 years ago now, speaking to the US, it was either Congress or the Senate, I'm not sure which committee it was. Anyone who believes exponential growth can go on forever in a finite world is either a madman or an economist. I think we need to look at the whole economic spectre through that lens. And of course, this is just one more of, but a particularly, I think, powerful way of framing the economics that we need, as opposed to the economics that we have. Kate Raworth's work in developing donut economics, that again, I'm sure many of you are familiar with, where we need to have an economy that's big enough to ensure a social foundation of well-being that no one should fall below, and of course, an ecological ceiling of planetary boundaries we should not go beyond. And of course, we are beyond 6 and probably 7 of them. So we need a very different sort of economy. And this is an economy that would be described as a well-being economy. Its focus is the well-being of all. So some of the things that are happening around that, there is something called We All, the Wellbeing Economy Alliance, which is a global alliance, an economy designed to serve people and the planet, not the other way around. So if you remember my earlier model that was flipped, we don't want it the way it is, we need to flip it back. And then there is a small partnership of governments that are interested in well-being economics, although I'm not sure it's terribly active now. The New Zealand government has changed, the Scottish government has changed, and they were two of the leaders. And then here in Canada, there is a small well-being economies alliance for Canada and sovereign Indigenous nations. So that's all provided there in case you want to dig deeper into the idea of a well-being economy. But this is all in the context that the second key health promotion action is to create a well-being economy. And incidentally, and I mentioned it in talking to the sort of pre-meeting here, WHO now has a focus on the economic and commercial determinants of health and is looking at the role of the private sector in determining health. And that, of course, would include things such as the impact of the fossil fuel industry on health, or the impact of the banks and the investment sector on health because of where they invest their money and so on. And there's going to be a global report next year along with the global conference. So this is a very interesting development with WHO turning its attention to a critique of our economic system from a well-being perspective. And then the third strategy is to develop healthy public policy for the common good. And I have not gone into this in depth. There's quite a lot of work out there, but this is just one example. This was World Health Day in 2022, when the theme of World Health Day was Our Planet, Our Health. These were some of the policy ideas that WHO, the World Health Organization, was advancing. Keep fossil fuels in the ground and stop new exploration and projects. Stop fossil fuel subsidies. Repurpose agricultural subsidies, reduce food wastage, build cities with green spaces, devise policies on waste and plastic reduction, and so on. But the point about this is that these are planetary health policies, if you like. They are things that are both good for the planet and good for the well-being of people. And so increasingly, healthy public policy needs to be thinking about what are the public policies that are good for the health of people and the planet. And we should be judging, I would argue, all public policies on their ability to improve health equitably and their ability to not just reduce harm, but actually to improve planetary well-being, if you like, planetary health. All of which takes me to the theme of transformative change. And again, I've hidden a number of slides here in the interest of time, but none of this is going to happen without significant transformative change. Just need to quickly wet my whistle there. So I like this, which just came out about a couple of weeks ago. This is a report from Lancet Planetary Health. So the Lancet, being a medical journal of record, has set up a planetary health journal, Lancet Planetary Health, after their commission on planetary health back in 2015. And they have worked with the Earth Commission on this notion of Earth system boundaries that are both safe and just. I showed you a a figure illustrating safe and just boundaries earlier on. But they made this really important point. We often talk about a transition to a well-being economy or a well-being society or transition towards sustainability. But they're arguing that this is more than just a transition. Transformations, they say, are more profound and comprehensive processes of change. While transitions tend to focus on reducing direct pressure on the environments, transformations involve systemic, synergistic, structural, political, practical, and individual changes. And I would say, I've got a typo in there, I just noticed at the last line, but they involve major shifts in values. So transformation fundamentally is a paradigm shift and a shift in values. In his 2017 book, The Patterning Instinct, Jeremy Lent talks about this and about the importance of people being prepared to change their values and behavior. And we need to do that both individually and collectively, and in our political and economic systems and in our societal institutions. And I'll come to some of the implications of that in a moment. And he talks about, and other people talk about, these three sets of core values. So there's 3 or 4 sets of core values, I would argue, that we need to be thinking about. He referred to an emphasis on quality of life, which is as opposed to having more stuff and growing the quantity of materials. A sense of shared humanity, which is in opposition to a sort of the hyper-individualism that characterizes neoliberalism and libertarianism, and of course environmental sustainability. So its focus is on individual well-being, if you like, and quality of life, on collective relationships, the social dimension, and on environmental sustainability, the global planetary dimension. So we need to be shifting in those areas. The Great Transition Initiative that some of you will be familiar with also talks about much the same thing. They talk about the triad of the conventional triad of individualism, consumerism, and domination of nature. And they again talk about the same set of 3 values that Lent talked about: human solidarity, or the collective or social capital, quality of life as opposed to more stuff, and ecological, they call it sensibility, ecological sustainability. So these are the areas in which we need great shifts in culture and society and the underlying values that underpin all of that. And in the report by Gupta et al. That I just referred to that came out in the last couple of weeks in Lancet Planetary Health, they talked about 4 fundamental and interrelated transformations away from, so part of it is reducing and reallocating consumption. So this has to do with equity in consumption, transformations of economic systems, sustainability and justice, technological responses, and in particular, I would highlight here, transforming governance across scales. So how do we transform governance across scales becomes an important discussion. I mentioned a homily that I gave earlier this year, in April of this year, to the Unitarian Church. And in that, I outlined a set of values that I thought we needed to transform. The first value set has to do with the earth. How do we establish a set of values that include reverence for the earth and all it contains, and awareness of a connection to nature that at its heart is spiritual? The second value set we have to transform is towards solidarity, towards the collective, a reawakening, I called it, of our sense of kinship with and shared responsibility for fellow humans, a sense of community, as opposed to, again, the isolationist, individualist, libertarian philosophies that drive so much of our thinking today. The third value set is the economy. So we have to dethrone economy from being the centerpiece. Instead, it has to be in service to society and consistent with the reality of the limited earth on which we live. And then finally, a set of values that talks about the priorities among these three things. And this is where I took that phrase I mentioned earlier: ecosystems sustain societies that create economies. It does not work the other way around. So we have to prioritize ecosystem values, we have to prioritize societal, communal, collective values, and only then do we look at an economy that enables us to prioritize and does itself prioritize those things. So we're talking about some very profound value changes, and the question is, how do we bring those about? One way to do that is through a focus on indigenous knowledges and perspectives. The notion, and this comes from an Indigenous people's statement on planetary health from a health promotion conference held in Aotearoa, New Zealand in April 2019. The Earth is our mother, the orientation to that, locating humanity as part of Mother Earth's ecosystems. So those sorts of the reverence for nature that again is inherent in this. I think there's a very interesting role, incidentally, in all of this for faith communities, for spirituality. When I talked to the Unitarian Church, I said, look, you're in the business of spiritual relationships with, among other things, the earth, spiritual relationships with others, community building. All of those things are things that faith communities do. And so how do we work with faith communities to reestablish a reverence for nature and to reestablish community? And numerous recent UN reports and other statements have recognized the importance of indigenous peoples. And in fact, Antonio Guterres said it well in 2020. It is time to heed their voices, reward their knowledge, and respect their rights with respect to indigenous people. So thinking about how that fits into a transformation of values and of society is something we need to give some attention to. And I want to end by talking about some of the steps that we might take towards being a well-being society, because it's very well to talk about these big, broad themes and issues, but how do we actually make it happen? I'm not going to repeat all of this. This is a restatement of the key challenges I've talked about with respect to the Earth being our home, the problems of rising inequality, an economic system that is driving ecological and social decline, a system of governance that I would argue is not fit for purpose in the 21st century, and that neither are our underlying core values. So how do we change some of that? I'm sort of the interim convener of something called the Canadian Coalition for Planetary Health and a Wellbeing Society. And we ground ourselves in an ethic of respect and sacred reciprocity with nature. And we are really trying to operationalize the notion of Canada as a well-being society. We're just starting out and we have big ambitions but small resources. I'm sure that's a familiar role. We talk about three roles for the coalition: education, research, and advocacy, and partnership around policy. So very briefly on education, if you're not aware of it, for example, the Association of Faculties of Medicine of Canada in 2023 produced a declaration on planetary health, which every medical school, every academic health institution in Canada, except I think one, I'm not sure, maybe they have changed by now and joined, but they've all lined up to and signed on with this declaration. Note that the academic health institutions declare the health of the planet a code-red emergency and call for immediate implementation of planetary health education and research and policies that would take us to a climate resilient and low carbon health system. I'll come back to that. It's an interesting point. On research, Richard Van der Yak touched on this, I think, in the introduction, because we're interested in three things. The first is that, as I say right there, CIHR, 25 years or more into its existence, has never had an institute on environment, which is crazy, considering that we're 80, I call this my 80, 90, 100 rule. We're 80% urbanized and we live 90% of our time indoors. So the built environment is a huge determinant of our health. And finally, of course, we spend 100% of our time within natural ecosystems. So we think that CIHR should establish an institute for environment's health and well-being to look at the health impacts of the environment and what you can do about it, the built as well as the natural environment. Secondly, if we're going to have a well-being society, we need a transdisciplinary approach. Creating a well-being society doesn't just involve the health world, far from it. It involves business and law and arts and culture and the humanities and the sciences, and you name it. There isn't a single faculty or discipline within the academic world or the professional world that isn't in some way involved in creating this. So to do that kind of research on being a well-being society, we need a transdisciplinary institute dedicated to that. And thirdly, because academic institutes and research programs are not advocacy programs, we need a way to take that information and turn it into public communications and public policy advocacy, and essentially create a social movement around this. And so we're also proposing, a few of us, led by Dr. Courtney Howard, the creation of something we call POWER, Planetary Health Organizations for Wellbeing, Equity, and Regeneration, which we describe as a pan-Canadian network of peri-academic think and change nodes. I don't know if any of you are familiar with Paul Kershaw's work to create Generation Squeeze, but it provides a model. The idea would be to link together think and change nodes that are working on various aspects of planetary health or well-being society through a national body. And it's all about knowledge mobilization and strategic evidence-based communications and policy advocacy. So we're at the very early stages of developing a proposal on this that we're going to be seeking funding for. So that's the second of our three strategies, so education, research, and number three is policy advocacy and partnerships. And we've got some tasks around that. How do we put planetary health and human well-being at the heart of governance? How do we value, respect, and nurture planet Earth? How do we heed the voices and respect the rights of Indigenous people? What about designing an equitable economy that serves human development, transforming core societal values and beliefs and worldviews, paradigms, if you like, adopting healthy public policies, and ensuring, because we come out of a health sector world primarily, that the healthcare system itself is ecologically sustainable. So here's a bunch of ideas about how we might do some of that. We created for World Health Day an open letter to the First Ministers, signed on to by 38 national organizations and provincial, including the Canadian Medical Association, the Canadian Nurses Association, Canadian Public Health Association, calling for a transition to a well-being society, including a well-being focus for Canada's economy. We proposed creating a well-being society secretariat in the cabinet offices or privy council offices in federally and provincially. We also proposed, and this model already exists, that every province as well as the federal government should pass a Wellbeing for Future Generations Act, as they have done in Wales, and establish the position of a Future Generations Commissioner. Our suggestion for a wellbeing budget that was developed in Aotearoa, New Zealand. I'm not sure that the new government there is in the least bit interested in a wellbeing budget, but we do have a bit of a model from the earlier government to build on. And this is just more detail, which I'm not going to go into here, about what the Welsh Wellbeing of Future Generations Act does. But it does require ministers as well as local authorities, health boards, and other public bodies to carry out sustainable development, to set and publish wellbeing objectives, and publish an annual report on their progress. That would be a big step forward if we got something like that in every province, as well as federally, and in every territory too. Another key step is going to be to recognize the rights of nature. I see that there's a law case right now that wants to recognize Lake Manitoba as a person, which has already happened in various places around the world. Aotearoa, New Zealand, again, is another good example. So recognizing the right to a healthy environment in the Constitution, which most countries do, but Canada doesn't. Recognizing the rights of nature to exist, creating personhood for nature, recognizing the rights of future generations, which I just talked about, and then finally recognizing the rights of other species to exist. Possibly not the smallpox virus and a few other things, but generally speaking, other species also have a right to exist. It's not an exclusively human prerogative. If you're interested in the healthy public policy part of this, there is something called the National Collaborating Center on Healthy Public Policy. It's published a piece that I did on ecological economics and public health, and it's published work on whole of government well-being approaches and other work, the well-being budgeting commentary highlighted in the center there by my colleague, Lindsay McLaren from the University of Alberta. So there's a lot of work going on healthy public policy. And then finally, the notion of a sustainable healthcare system. People don't generally appreciate just how big the healthcare system is. In Canada, it's 1/8 of GDP, 1/8. And globally, Healthcare Without Harm, which is a global coalition, estimates, and others have come up with a very similar number, that healthcare contributes 4 to 5%, not just of global carbon emissions, but lots of other pollution as well. Note that if the global health sector were a country, it would be the 5th largest greenhouse gas emitter on the planet, ahead, incidentally, of Canada. So the healthcare system is a huge factor to consider, particularly for those of us working in that sector or linked to that sector. So there is launched at COP26 a program committing nations to build climate resilient health systems and to commit to a target date by which to achieve health system net zero emissions. Canada signed on to the former, but it didn't sign on to the latter commitment. And even then, it took some prodding to make that happen. But of course, the problem is Canada, the federal government doesn't run healthcare systems. The provinces do. And the provinces have not signed on to either at this point. So that's an important focus for us to push on in terms of something real. And then we need to go beyond just a net zero system. This is an article I wrote in a journal called Healthcare Management Forum a year ago. We have an ethical duty in healthcare to do no harm. So when we harm the environment, we harm our patients, we harm our own staff. And so we need to be more than just a net zero system. We need to reduce our consumption of material resources, our use of toxic substances, our production of all forms of waste, and we need to protect and restore nature. We need to become a healthcare system with an ecological footprint equivalent to one planet. And that also has to happen at a local level. I have set up and run a small NGO here called Conversations for a One Planet Region. A recent report from UNEP called Navigating New Horizons noted that cities and communities have an essential role in achieving sustainability transitions, and talks about the important role of strong cities and local communities supported by robust local leadership as the bedrock of environmental resilience in a complex world. So how do we take this local? That's a big challenge. How do we take the conversation about values shift down to a local level? Again, an area where I think, for example, faith communities, indigenous communities, and so on could play an important role. And with that, I will come to an end. That's my contact if you need to reach me. I also, actually that website is for One Planet Conversations, but my website is called trevorhancock.org, I think. I never remember. But my weekly columns in the local paper are all published there. Anyway, I will leave it at that and turn it back to you, Richard, and to the rest of you for discussion and conversation.
Trevor, that was an excellent presentation. I really liked it. And even though as long as I've been working with you, I still think you presented very well. and made your points very clearly. I think one of the first questions actually is, well, actually, I'll ask the first one, is just could you define equitable health for the purpose of for the audience?
Yes, the notion of health equity, which has been around for a long time. I mean, in a sense, it's embedded in WHO created a program, back in the 80s called Health for All. And the notion of all in itself implies equity. It's not health for a few or health for some or health for most people. It's health for all. But equity is defined as inequalities that are considered to be unfair. So it recognizes that inequalities in health exist. There will always be inequalities. There are inequalities based on gender, based on age, based on all sorts of factors, based on your genetic profile. So we're never going to all have the same level of health throughout our lives. But there are levels of inequality that are considered unfair, and how that is determined is really a normative discussion that societies have to have. So when we talk about equitable health, we're talking about health inequalities that are considered fair and acceptable, understandable and acceptable. So that's the difference between equality and equity. And so health inequity is inequalities in health that as a community or as a society, we would agree are unfair or unacceptable. So, for example, it is, I would argue, unacceptable that low-income populations are more exposed to pollution than high-income populations. Uh,
Mhm.
and the many, many other examples. What degree of inequality is acceptable, if any, within that is debatable.
Jeff, you're next, but I'll just ask one last question, and that is, Trevor, I just wonder, for the purpose of the audience, it might be worth expanding a little bit on how pollution affects health.
Where do we begin? I actually just
Yes, I
wrote.
know. That's true. But
I just wrote a column about this. Um, the interesting thing about well, first of all, pollution affects health in all sorts of direct ways. I just wrote my column for this coming Sunday about pollution pricing, because arguing or agreeing with the argument that carbon so-called tax is actually pollution pricing. And so that means understanding, what is the cost of pollution. So, for example, a recent report from Health Canada back in 2021 estimated something like 15,000 premature deaths due to air pollution alone in Canada.
Mm.
So the stuff we understand fairly clearly is air pollution, water pollution,
Right.
toxic substances. But very usefully, I think, the Lancet Commission on Pollution and Health created a model that they called the pollutome. And it's a triangle. And the apex, and it has three levels. And the apex of the triangle is the health impacts of pollution that are understood and counted. And so when they talk about, in that slide I had, that 9 million deaths a year from pollution, they're
Yeah.
talking about stuff that we know the relationship between the pollution and the health outcome, and we've been able to measure it and we can count it. So those 15,000 deaths due to air pollution in Canada, or the 9 million deaths globally, most of which are due to air pollution, by the way, about 7 million of them.
Mm-hmm.
The second level was where we think or know that there is a health impact, but we haven't got an accurate count on it. So, for example, we know that dioxins and furans are potent teratogens and carcinogens and so on. But we know that they have a health impact, and we know that there are well, we call them safe levels, but levels that we shouldn't exceed. And we have some sense of what their impacts are, but I don't think anyone has a count on how many deaths or how much illness dioxins and furans cause worldwide.
Sure.
And the third level is newer chemicals and newer pollutants. And the planetary boundaries work refers to novel entities. So not just pollutants in the usual chemical sense, but plastic nanoparticles. What are the health impacts of plastic nanoparticles? We have no idea. We're beginning to see that. We've found plastic nanoparticles in coronary arteries, in placentas, in all sorts of body parts. We have no idea what their health impacts are. So that's the third level of the pollutome, where we don't even know what the health impact is, but we know that plastic particles are in all our bodies now. And so that 9 million is a considerable underestimate because it doesn't include the second and third levels of their pollutome model. So we really have no idea how big an impact nanoparticles, GMOs potentially, and other novel chemicals are having on our health. And I think an untapped area, for example, is what's happening to fertility and sperm counts and sperm tied in probably to that. But again, we don't have a handle on that. So that's why it's very hard to talk about the health impacts of pollution, because well, we don't even know how much we don't know.
No. Well, exacerbation of asthma and increased lung cancer, etc. But Jeff, you're on next, and after that is Dave.
Yeah, Trevor, just before we do, I want to thank you for an excellent presentation. One of the best that I've heard on CACOR before. So I don't want you to think that my question is a negative in any way, but I asked there, can you define low, middle, and high income countries that you talked about earlier? And then right after that, Dave Doherty gave us a link for a map that shows what I already knew, that the high income are really in the middle attitude industrial countries, and all of the low income are in the tropics and subtropics. But I was interested in how you might define it.
Well, I would simply define it in the way that the UN and the World Bank and other global institutions do. And you can incidentally find all of that in that's the numbers that, for example, the global ecological footprint, global footprint network uses is I think they use World Bank numbers in theirs. But yeah, there are well-defined categories of high, middle, and low income countries, and in fact, some of those have subcategories within them. But I mean, you're absolutely right. The high income countries, although if you're looking at high footprint, particularly high carbon footprint, the highest carbon footprints are actually all in Gulf states, where they have huge carbon footprints. But then you have mainly the industrialized North, of which Canada is one good example. And then low-income countries are the least developed countries.
Yeah.
GPT that don't care about anything else.
Yeah.
That's great. Dave, you're on next, and then after that is Ted.
Okay, thank you, Richard. Wonderful talk, Trevor. Thank you very much. One of Canada's claims to fame used to be that we had a low Gini coefficient, indicating relative income equality. Now that we've reached the high levels that places like the UK and the USA used to have, and they are even higher now, what does that say about how we should view ourselves? Have we become more mean-spirited?
Well, I think what we're seeing here is a largely global and certainly an industrialized country phenomenon that I would date back to the ascendancy of neoliberalism with Thatcher and Reagan in the 1980s, 1970s actually. And so what we've seen is a shifting in priorities. So, and that goes to this discussion about values. So it's become very much the sort of neoliberal and libertarian philosophy that says buy matter and the hell with you. Basically, it's a philosophy that worships selfishness, and you know, I need my stuff and I need it now, and I need more of it, and I don't care about the consequences. But it also just undervalues what neoliberalism has done is chip away at the sense of collective responsibility, chip away at the role of government. So it's all about let's reduce the role of government. I happen to believe in a phrase that came from a US Supreme Court justice, having a blank on his name for a minute, come back to me, 100 years ago, who wrote that taxes are the price we pay for a civilized society. And we've forgotten that lesson. So if you look at where the happiest, the most best societies, they are often seen as being the Nordic countries, which have had high levels of income equality, but lower levels of inequality, I should say, large government programs, higher taxes, and so on. So I think that what underpins all of this is that that neoliberal ideology. That's why I think that the values debate is so important. We have to get, and when I write my columns, I get people who write me and say, you know, that's never going to happen. I want my stuff and I want it now. They almost exactly say that. So we've shifted, I think, from a sense of collective responsibility that was there in the aftermath of the Second World War in particular. I mean, the National Health Service in the UK, I'm an NHS baby. I was born 3 months after the NHS was established. I've only ever known that form of healthcare. But we've been losing that commitment to the collective and to the role of government. And we've seen instead the role of the private sector. And that's why WHO is looking at the commercial determinants of health, because much of what the private sector does harms people or harms the environment in meeting the demands of society. So we have to change the demands, and we have to change the way that the private sector operates so that we build in. There's an article I'm going to be writing out in my column next week, looked at the hidden costs of food, and this is not new to any of you, but you know, beef costs $3.50 a pound in Walmart in the US. But if you factored in just the environmental costs of beef, it should be $22 a pound. So that extra $17 a pound or $18 a pound is actually being shifted onto the environment, shifted onto people, and they end up paying for it one way or the other. But we're not paying the true cost. And meanwhile, the corporations make a pile of money because they're not paying the true costs either. So all of that has to change.
I actually have 2 more questions. Quick comments, if you would, on each of these. What role might public benefit corporations play in the necessary transformation? That's the first one.
Oh, I think that's a very interesting way to go. And if you start to define what's the word I want? The performance of a corporation in terms of how they contribute to the well-being of society. In these broad terms, it can't be in narrow terms. It's not just about creating profit and creating jobs, or in fact, of course, one of the ways you create profit is by underpaying people, shifting them to part-time work, getting rid of benefits, getting rid of people and replacing them with machines, all of that. So those might be seen as profitable things for corporations to do, but in societal terms, they're not, never mind the environmental harm they cause. So shifting to the notion of public benefit, I think, is really an important way to go. And the conference we're planning for November in Vancouver with WHO is called The Commercial Determinants of Health from Harmful to Healthy. So how do we shift that? And so I think public benefit corporations, co-ops, all sorts of things like that, where the stakeholders are more than just shareholders, is the way we have to go.
Yeah, my impression is that corporations largely started with public benefit corporations. And the idea was not, in fact, to make profit. Okay, so this other one is, what level of concern should we have with pollution pricing, simply allowing the rich to pay, because they'll have no trouble paying, to release substances that harm others, both human and non-human?
Well, part of what you do with that, I think, is pollution pricing in itself is not the full answer, because you don't want to create just a license to pollute and then those who can afford to pollute pay for it. So you have to combine that with regulation. But the point of pollution pricing is to drive down demand. And yes, there will be some who will just go ahead and pay it anyway. But you can use that. You also need to tackle those kind of things with things like wealth taxes. It's not just a matter of pollution pricing solves all our problems. It's a particular tool for a particular context. But you still have to go after the wealthy in terms of taxes. They have shifted taxes away from the wealthy, and right-wing politicians like to do that. They like to give tax breaks to the rich and all the rest of it. So we need to, again, that's part of that collective responsibility.
I think there's one other potentially interesting element that could be added, which is rationing. I know your parents went through it, if not you, in the UK when you were young. And I really think we need that back. Everybody should be allowed perhaps a few thousand kilograms of CO2. But if you want to put out 10,000 kilograms, yeah, you should pay 10 times as much as everybody else. You want to pay 20,000, you want to emit 20,000 kilograms, you ought to pay 1,000 times as much. 10, and for every 10 you add 2 zeros.
We should probably move on and get some other comments. I know Linda Tyre had her hand up, and I think
that's right. No, and the next one is Mike Nickerson.
Thank you.
And then after that is Linda.
Ted was on deck. Do you want Ted to make his
Oh,
comment?
Ted, sorry, Ted, you're next.
Yeah,
And
I
then
probably
Mike
should,
Nickerson.
because I may have to leave early. And I would very much like to thank the speaker officially, because I was going to do that at the end, but I may have to go. Anyway, this was fabulous. I think we've been doing the same stuff for a long time on well-being. And I just got back from the UN sessions where a lot of what you said is almost 100% synchronized. So there's an awful lot of people out there trying to make this happen. And that's what was so frustrating with all of the NGOs there, and even some of the other governments, the small island developing states, all agree with virtually everything you've said. And most of them are terribly frustrated with their inability to shift the ideas to values, to goals, to responsibilities, rather than simply mechanisms or how to transfer money more effectively from one place to another. Anyway, that's just a general observation. But what I think is possibly useful is, how do we actually establish individual and corporate and other responsibilities? Because we don't do that very well right now. And secondly, even will the Sustainable Development Goals help in any way? Because obviously there's the one on health, number 3, that has all sorts of things in it. There's lots on cleanliness, on clean water, on clean air. Are they actually going to be a useful tool to make people consider all of the aspects of environmental contamination and ruining of our ecosystems? Or are they just another PR scam?
Well, I don't have a solid answer on that, I don't think. I mean, I think part of it is we have to change the rules on what corporations, for example, have to report, and they should have to report on their social and ecological impact, as well as their financial impact. There's some couple of weeks ago, about a month ago now, there was something called the Victoria Forum, which is organized every 2 years by the University of Victoria and the Senate of Canada. So it's quite interesting, and you get a lot of high-profile folks there. But there was a woman there whose name escapes me for the moment, from the Cambridge Sustainability Leadership Institute. And what she was talking about, and she spent a whole chunk of her recent years developing with the International Standards Organization, is a new standard, ISO 37000, which is a standard for purpose-driven organizations. And it argues that organizations, all organizations, not just corporations, governments too, and at all levels, should adhere to a standard that puts purpose at the center of their being. And that purpose, her language was pretty much the same as what we're using. The language of purpose was around ecological sustainability and well-being for people. And so that may be that's a different way. That's not imposed by government. That's what makes ISO interesting, is that it's a sort of an NGO, really, but it's quite powerful in its effect. So I think there are ways like that that we have to, and governments themselves certainly have to redefine. For starters, let's stop using GDP.
Right.
Let's go to GPI or some other measure that I personally like GPI. It's been around a while. Let's put out well-being budgets that focus on. But how do we put, the question that we pose ourselves is, how do you put planetary health and human well-being at the center of governance? Because right now it isn't there. And I would argue that the minister for well-being, if you like, is actually the prime minister. And the whole
There's only one country where it almost does that now, and that's Bhutan.
Yes.
And where they've actually attempted to go that way. I would consider them to be a good initial success story that may inspire people. But that, Trevor, I think is what you're hitting too. We got to have inspiration. There's got to be somewhere to go rather than just to run away from the stuff that doesn't work.
Well, that's why I like pointing to the examples in Wales and Aotearoa, New Zealand, and so on. But yeah, this is not only feasible, it's actually being done. It's been implemented. So if they can do it, and Bhutan, you're right, is another very good example of how to do that.
Okay.
Thank you very much.
Okay, so Mike, you're next, and after that, Linda, you're on deck.
Well, thank you, Trevor. It's good to hear you speaking. I've been appreciating your articles. You worked with my mother, Betty, and her partner,
Yes.
Seymour Tiger, back in the early Green Party days, so
Yes,
we're not unfamiliar. The cultural transformation that has to take place for any of this to be accepted, it's going to require a popular uprising, basically, in one form or another, to convince the powers that it has to shift. And we've been using the phrase "more fun, less stuff" as a very fine 4-syllable intro to the general direction that we need to move in. And I wondered if you can see any value of priming the field in that way.
I think that's a great phrase. I love it. And I think that's why I ended by talking about local action and what we're trying to do and others are doing at a local level. So, for example, Nanaimo has adopted donut economics as a framing for its official plan and things like that. I think, and I spent a lot of my time, particularly in the 80s and 90s, working on a WHO and global movement called Healthy Cities or Healthy Communities. I've always been impressed by the ability of things to start at the bottom and move up. And the work we did in the 1980s against tobacco was not starting with the federal and provincial governments. It was starting with local governments. And it was the city of Toronto and Victoria and other places that put in the first bylaws around smoking. It wasn't the federal or provincial governments that were imposing these requirements. So I think that notion of conversation, I think, is really important. How do we have a conversation? We don't have a mechanism to do that. I just wrote a column recently suggesting that here in Victoria, we need a kind of local leadership council that is an NGO, essentially. It could be based, I suggested, out of the Victoria Foundation, which is our community foundation, that brings together different stakeholders to convene a region-wide, months-long, maybe years-long conversation about where we're going and where we need to go. Citizens' assemblies, things like that. I think we have to have these conversations at a local level. That again is why I'm not a person of faith. I'm an atheist, but I do see the role and the value of faith communities because they are often the stewards of values in a community. And I don't always agree with where some of those values take them, but there are others who definitely do. And so I think we need to be looking at how do you work with all of those sorts of organizations to have the conversation about where are we going. And yes, I like the idea of more fun, less stuff.
One of the key details that the more fun introduces is that to become consumers, we had to give up a whole lot of stuff. Because before there was like television, radio, and newspapers and all of this consumer stuff, we used to relate with each other. We'd learn stuff. We'd appreciate the world, that this was what human being was.
Mm-hmm.
And we can reclaim that. So it's not all about tightening our belts. It's about, look what we lost, look what we can reclaim. And in the process, we can provide the same for our children and grandchildren.
Oh, absolutely. And I think that's why the focus in the alternative economics sphere on quality of life is very much about that. It's things like time to do things. It's personally for me, I'm a dancer, and when I go out there and dance, and I do it 2 or 3 times a week, I'm not thinking about any of this stuff. I'm thinking about dancing and having a beer.
Sounds good.
And it's very low consumption.
Yeah. Thanks very much.
Okay, Linda, you're up, and then after that is Art. You're on deck.
Great, thanks. Thanks so much, Trevor. This has been an awesome presentation, and I always keep learning from you. I'm a clinician, don't have the public health sort of background, but I've learned a lot from Trevor over the years. My question is a little bit about the inequity and how that you presented at the very beginning those slides around inequity around the world, or inequality, I should say. And how I think those are based on income and material measures, and looking at how there needs to be this adjustment of inequality, which usually means bringing those lower, whatever quality, whatever you want to call it, people up to our standard, our higher standard. And I'm wondering if there have been any studies or work done on measuring with a new set of values of less stuff, and how these equalities are viewed in a new kind of measuring. And I wonder if that would also be helpful towards seeing like a relationship with the land, for instance, or having these cultural rituals and things like that, like dance and whatever else it might be, and whether or not that could be a draw towards a different way of seeing things, a different richness, different wealth.
Yeah, I think so. And I think that's why, for one thing, it's important to emphasize that there's at least 4 different forms of capital. And they are not just economic capital, wealth, and so on, but natural and social and human capital. And in the human capital one in particular, human capital involves your level of education, your level of health, your level of creativity, your engagement with other people, your ability for compassion, and so on. So I think there's a whole bunch of ways of measuring that, those are aspects of quality of life. I also think that if you look at things such as the Canadian Index of Wellbeing, it measures a wide variety of different things, some of which are about your environment, and some of which are about your economy, and some of which are about your time is an interesting one. Leisure time or free time is another piece of it. So there's all sorts of ways of measuring that. The gross national happiness in Bhutan is measured through a community survey that measures many of these things. So yeah, I think looking at that in different ways. The other thing is, I have a sort of mantra when I talk about poverty and health or inequality and health in cities, and I point out that I put up a slide of London, and I point out that the East End is poor and the West End is rich, and we think of East End London as the poor end of London. Why? Well, it turns out the river flows from west to east. The air generally goes from west to east. If you've got enough money, you live upwind and upstream. And if you don't have it, and that makes land there more valuable. So you get all of these other ways of inequality being built in, geographic inequality. So you can look at a place and you can pretty much predict where poor health is going to be by looking at where water flows. And the mantra I have is the poor live downhill, downwind, downstream. They live uphill if the hills are dangerous, such as in Rio. They live in floodplains. They live near to waste dumps and toxic factories and so on and so forth. And you can map all of that and see very clearly where those inequalities are. So you have to look at people's environment as well as in measuring inequality.
And has that been mapped? Is there global mapping? Yeah, okay. There's
lots of that sort of mapping around. And then just today, early today when I was listening to the Current, the Current, or maybe it was it was the Current. They were interviewing someone about the Toronto tree equity survey, and they have mapped green space inequality. Lots of other places have done that too. And again, what you find is that low-income people live further away from green space, have poorer quality green space, and so on. And the flip side of some of that, if you translate that into a policy perspective, I've argued and others have argued for what is known as proportionate universality. So everyone should have access to green space. But if you're going to build parks, you actually need to build more parks for people who are living in low-income neighborhoods than for people living in high-income neighborhoods. High-income people will look after their own green space. They'll have a garden. They'll belong to a country club. They'll have access to a green space outside of the city. Low-income people don't have any of that. And so you actually need to have disproportionate universality where you provide more of something. I mentioned earlier the difference between equality and equity. When it comes to health services, providing high income and low income people with the same level of health service, equal health services, is actually inequitable, because low income people have worse health and they have greater needs than high income people. So you actually, to get equity, you need to provide more health care per capita to low income populations than to high income populations. So equity is not the same as equality. Equality can be unfair.
All right. So the next question is Art, and then after that, Jeff is on deck, and then the last question will be Raymond.
All right. As most people in CACOR know, I come from a focused energy perspective, and clearly hospitals are well known for being very large energy consumers. Had a very difficult period of time working with the new Ottawa hospital, whereby they were more interested in having the CSA standard as being their guiding light, which is, I don't know, 100 years old, 50 years old, but which depended on diesel and gas plants, and not too interested in having any solar energy or batteries, and whereas the resistance I found absolutely staggering when much of the rest of the world is making that transformation. Is this common throughout the the healthcare system in Canada that you're aware of, or was this a sort of a one-off abnormality?
I don't think it's one-off. I would say that hospitals are, or the healthcare system is much like the rest of society. And I used to, for example, I spent a lot of time, particularly in the 80s and 90s, working as a health futurist and looking at alternative futures for health and healthcare systems. And I would always make the point that the tail doesn't wag the dog, that if the society defines the healthcare system it will have, it doesn't work the other way around. So if society doesn't really care about energy efficiency, then healthcare systems are not going to care about it either. So what you see is quite a spectrum. I was involved 25 years ago now in establishing the Canadian Coalition for Green Healthcare, and that is still an ongoing and active organization. And it was inspired by Healthcare Without Harm, which started out as a US organization. There is quite a lot of work available, and Linda, incidentally, who's on the call, is a key player and coordinator of a group called Doctors for Planetary Health out here on the West Coast. But there's lots of groups that are working in one way or another, both within healthcare systems. So we have several places now that have established planetary health offices. We have, there's something called Green Care, which links 3 different health authorities, Providence, Providence Provincial Health Services, Fraser Health Authority, and Vancouver Coastal Health, and links up their work on environmentally responsible healthcare. So there's quite a lot of activity, not just around energy, but around all the things I mentioned earlier in my slide. So resource use, recycling, for example. A long time ago now, the university hospitals in Toronto funded their environmental coordinator out of their savings on waste management, because they improved their recycling and reduced their the amount of stuff going to incineration, which is a very, red bag stuff, dangerous stuff has to go to incineration. But incineration is a much more expensive form of waste disposal. If you put stuff into the red bag that doesn't need to be in the red bag, you're wasting money. And so working on things like that. So I think part of it is you have to show them, I think there's 2 things. You have to show them that there's at least economic neutrality, because healthcare systems are pressed for money and they're not going to do something that's going to cost more unless they're told to. But secondly, their attitude also in some cases is, we don't care about the environmental costs because we have to save patients. And so whatever it takes to save patients, we will do, regardless of the costs. Now, those are not incompatible aims. And so you have to find ways, and that's what the Canadian Coalition and others do. For example, a lot of work was done on plastics. There's a lot of plastics used in healthcare. Well, how many of those are actually delivering nanoparticles into the bloodstream? And how do you change to a different sort of plastic or a different way of delivering your product? And so on and so on. So there's huge potential, but you do encounter institutional resistance, just as you do in the rest of society. So you hit a bad example, but there are good examples out there.
Thank you.
Okay, thanks. Jeff, you're next, but I'll just mention one comment that I did post an article this week on the CACOR site from the JAMA that was just published this week on how we could move to a more sustainable healthcare system. So Jeff, you're up, and then after that is Raymond with the last question.
Actually, I think Raymond's question is more important. Would you let him go first?
Sure. Yeah.
What Trevor thinks about it, and if there's time left, I'll ask my question after.
Well, actually, thanks a lot, Jeff. But so Trevor, very good presentation, and I agree with. I don't think there's anything I disagree with in your presentation. The concern I have, though, is a lot of that is about talking about changing culture and talking about putting structures in place to make that happen and all that. Yet we're in a climate crisis, right?
So do you have some thoughts about, is there some way for us to short circuit this? Because, changing culture is probably the most difficult thing to do, right? And I've seen this in my advocacy with EVs. Is originally we used to talk about the environmental benefits of EVs when we did shows, but with time we realized that most people was all about me, myself, and I. So what we did is we changed the messaging to respond to that, to try to figure out how to get these people to adopt a solution that's better for the planet, because it's good for them, right? There's a benefit for them. So do you see any ways of short circuiting that? Because there's been lots of talk about lots of things, the COPs and all that, and we simply don't seem to get to taking enough action to bend this climate problem, right?
Yeah, well, several thoughts about that. I mean, certainly, I think the whole realm of cultural evolution is something that we need to study and understand better how it happens. I think, for one thing, if I've talked a lot about neoliberalism, that in itself was a culture change, a value shift, and it was a very deliberate one. If you go back and look at Milton Friedman and Hayek and so on, they were very deliberately placing their people in high level positions in government and in academia, and sort of preparing. They've talked about how they were sort of preparing for the opportunity, and then along came Reagan and Thatcher, and they grabbed the opportunity. And so that was a culture change that was engineered, if you like, not entirely, but that was a big chunk of it. We've seen culture change. I mean, at a small scale, for example, 30 years ago, you'd have walked into a restaurant, people would have been smoking. You'd have walked into a lecture theatre, people would have been smoking 30 or 40 years ago. No one would dream of doing that now. That in itself is a culture shift. Another example I often use is gay marriage. Gay marriage was completely a non-starter for decades. And then almost overnight, it seemed, in countries all over the place and states all over the place, it became accepted and normal and regularized. That didn't, and it seemed to happen pretty much overnight. It's certainly very rapidly, but it's because there'd been a long, slow build-up, as there was with smoking. So part of it is what we're looking for is what are called social tipping points. And so you keep building and building and building and building until you hit that tipping point. And you never know with tipping points where the tipping point is until you're past it. And you then look back and go, oh, look what just happened. So I don't know. I mean, I think that we have to just keep working to build that, but we also need to understand a lot more. I mean, I'm on this policy of the Science Advisory Committee for Thomas Homer Dixon's Cascade Institute. And one of the things that institute is interested in is social tipping points, and how do you engineer social tipping points so that you don't just leave it to luck. So I think we need to understand a lot more about how cultures evolve and how to shift them. And how do you also do that in a way that isn't just straight coercive? I mean, you could, put a dictator in place and change it, but that's not a democratic or, to my mind, socially acceptable way of doing things. The other thing I think that happens is that as the crisis becomes worse, the appetite for change becomes greater. I think there are sort of two groups there. There's one group who will batten down the hatches and say, wow, we're going to get through this. We're going to stay on this course. And, but there's another group that gets, I was on something called I was on the board of the National Survival Institute back in the 70s. And Vern Heaslip, who had established it, used to say, give me $500 million and I will make the crisis worse, and then the change will happen.
Yeah. Well, you've given me hope. Thanks a lot.
Okay. Jean, you're up.
Thank you, Richard. And does Jeff want to give his question at this stage or no?
Jeff, it's our call.
Yeah, we've run out of time. Go ahead, Jean.
Okay. All right.
Say I could if Trevor will make these answers short on it, but we're running pretty over time. Well, I'll go ahead.
No, let Jean go.
Trevor, I was just going to ask, have you thought of running for the Green Party of Canada? Now, I realize you have before. You were involved in creating the party along with Elizabeth May and others, but the climate has changed. We're in, I mean, the climate for politicians too, and we're into a climate crisis, as Raymond says. And
So I can give you
politicians consider the economy first and the environment if there's anything left over.
I can give you a short answer. No.
I don't blame you, actually.
Been there, done that, got the scars. I've
Yeah.
moved on to other things.
Okay, Jean.
Trevor, thank you so much for a fantastic presentation. I was in awe and agree completely with everyone who has said that you gave a really, really good talk and one of the best ones we've had in a very long time. So thank you very much for that. And as I say, on behalf of CACOR, it has been delightful having you come and present to us. So thank you.
You're very welcome.